Hello, my name is Dr. Jill Olausen, and the purpose of this video is to show you around healthcare administration preceptor instructions. So the first thing I wanted to review really was the terminology. So when we talk about in our HAL program, we call our clinical experiences practicum. So practicum is the term used instead of clinical. Course faculty is the person who would be running the didactic component of the course. Preceptor would be the professional at the practicum site, and 1 unit equals 45 practicum hours. So in the healthcare administration and leadership, these are the courses that we have. The 2 practicum courses should come at the end of the curriculum. There's 543 and 567. So the general preceptor qualifications, so we request that the preceptor hold a current RN license, that they should have a Master's of Science from an accredited institution, and preceptors with healthcare degrees other than nursing, so maybe a Master's, an MBA, will be considered for the HAL program. They should have an ability and willingness to assist students in achieving practicum goals. And just a note here, the student's immediate supervisor at his place of employment may not serve as the student's preceptor. So there's the 2 experiences are GNRS 543, and this is a 4-unit course with 2 units of theory or didactic or classroom, and 2 units of practicum hours, so that would equal 90 total hours. And the other one is 567, which is a 3-unit course, 3 units of practicum hours. In 543, the course description states that this course focuses on principles and models of care management in a multidisciplinary practice environment that emphasizes healthcare delivery through integration of services and transition management. The student is introduced to decision-making related to allocation of resources and services, development of protocols, and evaluation of management approaches. Evidence-based approaches to clinical, administrative, educational, and research dimensions of patient care will be emphasized. Evaluation of care management activities with the student-selected clinical population is an integral component of the course. The course descriptions are to describe various models of care management and the utilization of evaluating the quality of healthcare delivery, describe the roles and responsibilities inherent in managing patient care as part of a multidisciplinary team, critique the literature and research with respect to selected clinical improvement projects and national guidelines and standards of care, and develop a logic model describing the analysis, literature, interventions, and evaluation plan. So generally in this course, we're looking for students to be at a place that the population is complex and has many encounters with the healthcare facility, so they can see how this patient population transitions across the care continuum. Preceptor qualifications, so we discussed those. The student should choose a healthcare setting that utilizes care management to deliver care for complex, high-risk patients. That would be great if, in addition to the preceptor qualifications for this clinical, they were leaders of interdisciplinary teams that oversee management of these types of patient populations. Preceptors with degrees in business and management are ideally suited to serve as mentors for this practicum. Suitable populations might include something like cancer survivors, older adults, individuals with isolated or multiple chronic conditions. The student will ask you to review a learning contract with them where they will develop specific goals. These goals will be based on the theory component of the course. Students will be asked to conduct a SWOT analysis And then they will be asked to take some of the opportunities they found in the SWOT analysis and develop an improvement project. And then they use a logic model to map out this improvement project. Preceptors are encouraged to attend a final presentation they will give, and we could do that virtually through using a Zoom meeting. Preceptors won't grade any of the students' work, but they will evaluate students on their engagement and professionalism in the practicum experience. In 567, this course provides the students with opportunities to experience the role of healthcare administrator, an individualized administration practicum in a specific area of clinical emphasis is chosen by the student and approved and monitored by the faculty and preceptor. Competencies that govern the role of healthcare administrator are explored in depth, and students focus on the context for enacting the role of administrator in healthcare delivery system. The objectives are to use theory and research from healthcare leadership and other disciplines to direct practice as healthcare administrator, apply administrator processes to change an organizational practice or resolve an organizational issue, to analyze, implement, and evaluate the role of healthcare administrator, and integrate a Christian worldview in the administration of healthcare organizations. This course also would like that the preceptor be a nurse administrator or someone who's had a leadership experience. The learning contract for this course will just look at the different goals that the student will have and make an agreement with the preceptor, and the goals will be approved. The learning contract for these courses should be based on the final practicum assignment due in this course. This includes an environmental assessment plan and a business plan. This will be presented in the final weeks of the practicum, and here the format of the final assessment is over here to the right. So expectations for preceptors of students in the HAL program. Initially, you would meet with the student, provide the student with a you would review this learning contract and review the goals outlined by the student. Then for the orientation, I will send out an email to you and ask you to have a short phone call with me, and then we go over the goals of the practicum and ask if you have any questions at that time. And that is probably only like a 5 to 10 minute phone call. And then during the precepted experience, you would communicate with the course faculty at least twice during the semester, and then you could notify course faculty, that would be me, if there are any concerns, and also discuss the learning contract goals regularly with the students. At the end, an evaluation form will be sent to you to fill out. And that's it. We really want to thank you for contributing to the future of nursing, and we appreciate the time and the energy you give to our students.